Welcome to
This meeting is being recorded.
good afternoon, everyone, or good morning if you are in Canada and it's lunchtime in the UK. We are very excited to be hosting an event for UK's Dying Matters Week. I am Seow from McMaster University in Canada. I am a researcher in end-of-life and palliative care, and I'm very thrilled to be co-hosting an event with my friend Clare Fuller.
Hi, I'm Clare Fuller, and I'm an advanced care planning educator, advocate, and coach. And this is a great opportunity to work with you, Hsien, today.
Yeah, we both have a podcast. We both have resources and tools on our websites. But today we are focused on spending 30 minutes with you to share very simple strategies for patients, families, and healthcare providers. And we're going to sort of give you a really quick, tease, a taste of some of the things that we work on, and hopefully leave with some practical tips. The one thing that I want to let you know is we are only going to talk for 15 minutes or so and going to try to leave time for questions, to answer questions that were submitted, or those of you who are here today, if you have a question, please use the chat and we will answer them live today. And I have a team member on the line. Her name is Kayla. And if you have any issues, you can also use the chat and she will try to help you figure it out. But we're using, okay, so if you have questions for her, Claire or myself, please use them. We'll answer them. We'll definitely leave time. And welcome. Okay, today our chat is about Dying Matters Week, but as you may know, this idea of palliative care often is introduced very late in the illness journey, and it's sort of in the stream near at the very bottom. And we want to go upstream and improve the whole journey for patients and families. And the key to that, we think, both Claire and I, is having patients and families have full information and be proactive and prepared. And that's how we can go upstream and improve not just the end of the journey, but the whole thing. We got to go to the beginning. And that's what some of our tips will be about. They will help you to die well if that's the stage you're at, but it will also help you tomorrow if you implement some of these tools. That's our hope. We want to help support patients move from being in the dark and unsure of where they are, feeling overwhelmed, to in the know and more in control with more choice. And so I'm going to talk about a few tips that we have come up with. We talked to thousands of patients and families, myself and my podcast co-host, Dr. Samantha Winemaker, and we created these 7 skills to being hopeful and prepared when facing serious illness. They're skills, they're like mindsets, and hopefully I'm going to talk about 3 of them in particular, but there are only 7, and they're metaphors like walk 2 roads or know your style, and how that influences your journey. And once you tap into that knowledge, you can use that to your advantage throughout your whole journey and be able to leach out information that might be hidden to get the best, to be fully informed. Okay, so I'm going to talk about 3 of them, but all 7 are available on some of our resources. I'll share that in a second. One of them is called Walk 2 Roads. It is the idea of you need to be able to walk the road of hope, hoping for the best, but also the road of planning for the rest. Hope for the best, plan for the rest. And this is an antidote to this idea of, well, toxic positivity or everyone around wanting to be super cheerleaders, there's definitely a time for that and is usually welcome. But sometimes that's so positive that people avoid thinking about what they need to plan for. So a tip thing that you can do is ask yourself what you're hoping for and then what you might need to plan for just in case. And if that doesn't quite work exactly, what are the things that you want to happen? Or what are things you might need to plan for? And it's a way of shifting lanes and living in 2 worlds at the same time, but still being hopeful, but prepared. The next key is this idea of zooming out, where it's very easy to get sucked in and zoomed into the weeds of an illness. And we want to encourage you that there is information about the big picture of your illness and how to ask about that. And so, if you might ask about the future, they might say there's no crystal ball or you're not there yet. Well, you want to be able to say, I know I'm not there yet, but I like a lot of information and I want to know what the beginning, middle, late, and end stage of my disease is and where I'm at and what I should expect in each of those stages. I don't only want to talk about things when I'm at the end stage. I want to know all throughout my journey because they do have that information. They've They're experts in this. And so you can ask about the whole illness, what you can expect along the way and the decision points. That's zooming out. Once you have a big picture, then you can zoom back in. But without that context, that roadmap, it's kind of hard to know where you're at. And we want you to know that that information exists. And it's different. That storyline is a different question than the timeline. How long that is. That might vary from person to person, or it might be quite, consistent. But you may not want to know the time, but you may want to know the storyline. So these are two different things. You might want to know both. That's your right. And last but not least is this idea called customize your order. It is the idea that there is a standard of care for most illnesses, and you do probably want to know what the evidence base says for getting the standard care, the best, what science says. But there are ways to tweak that care plan that match your preferences. There are many opportunities to bring forth what you value most forward to say, this is important to me. How will these decisions affect what is important to me? And if you don't bring what you value most forward, your clinician, and team will just think you're a generic, size, one size fits all. But you're not. You're an individual. So it is as much your responsibility to bring that forward and say, these are the things that are important to me. And then you can customize your order so that the experience will feel more like you and not, a number. So those are three of the keys. I hope some of those things that you could ask yourself are things you could think about. All this information is on our website called waitingroomrevolution.com. We created that because we wanted a revolution in the waiting rooms everywhere, where patients and families ask different questions and get different information, help take charge of their illness. The website is free, of course. And if you sign up for our listserv, right away, you'll get access to this one pager, which talks about the 7 keys and then a simple action you could take. And we actually talk about each of those keys for 40 minutes on season 1 of our podcast called waitingroomrevolution.com, which is available everywhere you get podcasts. And we talk about each one and how you can implement it and what it means, a little bit much longer than what I just did there. So that's something you could check out if you're interested. And our podcast has been, surprisingly successful. We're now in season 6. We have guests like Harvey Chachnov, Catherine Mannix has been on our show, various experts around the world, including patients, families, and all kinds of social works, death doulas, etc. We talked to a whole board. We're thinking about palliative care in the broadest sense, about living your best life, really. One day we'll have Oprah, I'm hoping, because she talks about living your best life. We're on social media. You can follow us on all of these platforms. We're on other people's podcasts, TikTok, Twitter, Instagram. And of course, we are excited that we have a new book coming out called Hope for the Best, Plan for the Rest, which is available in pre-order now everywhere, including in the UK, and it comes out September 19th. So you can join our listserv or pre-order, and we're having a pre-order sale coming up, so you can just sort of stay tuned for that. And that's it. So I'm going to pass it over to Claire. So I talked a little bit about some of the tips of the 7 keys and where you can find out more information. And Claire is going to share some of her information. And I think that's going to connect more to advanced care planning and deciding.
So thank you, Hsien. That was a lovely introduction. And I've been a guest on your podcast and you on mine. So it's great to work with you together on this presentation today. So I'm Claire, and thank you so much. It's great to see all of you today. And I'm interested in advanced care planning because I've seen firsthand and too often what happens when plans aren't in place. And as Hsien says, the key is to upstream these plans, not do them at the last minute. So I'm on a mission to get those plans upstreamed along with Hsien. I'm aware of a need to improve professional understanding and public awareness about advanced care planning. And I think the day, as members of the public, we start asking healthcare providers for the information, as Hsien has suggested, that'll be the time that we start that revolution, that we start demanding advanced care planning from healthcare providers. So I'm on a mission to improve professional awareness and public understanding. And I do that through education, through talks like today, and through resource on my website. And I'll come to that at the end. As Hsien said, I podcast. Lots of my information and the stuff that I learned goes out through podcasts, and I've had some great guests, and I'll weave those into the talk today. So Hsien, thank you. You've presented an outline of the ways to navigate an illness, and I love that navigation of an illness. What I'm going to share now is a framework that I've developed just to help summarize the tools that'll help you get your house in order. And as you said, Hsien, it is a whistle-stop tour. We're both challenging ourselves to do this in an incredibly short time. So what is the basis of every single house? The basis of all good houses are strong, firm foundations. And the foundation for advanced care planning is what matters most to you. So the way you develop your plans is you customize your order and you develop what it matters most to you, and you share that with your healthcare provider. And it's quite okay to say, this matters to me. My daughter is getting married. This matters to me. I want to be able to walk my dog on the beach. This matters to me. So decision making is based on what matters most to you. So let's explore the house a little bit now we've got the foundations in order. Behind each window I'm going to offer you are 5 different things. Firstly, the things you do want. And as I go through the talk, we'll look behind that curtain just a little bit more detail. Secondly, a second window you can think about in the framework are the things that you don't want to happen to you, which is just important actually, is maybe the things you do want to happen. The third window I'm going to talk about is who would speak for you if you lost capacity to speak for yourself. And for our Canadian guests, I believe you call it a proxy decision maker, if I'm right there, Hsien. So we'll talk about who would speak for you if you couldn't speak for yourself. Possibly, is this my most favourite window? Your legacy. All of us have got something that we want to leave behind. All of us have got something that matters seriously to us and we want to leave behind. And I encourage us to think about our legacy ahead of time. What memories do we want to make, share and leave with the people we love? You'll notice a very small window I've put in for end-of-life care. So advanced care planning, yes, end-of-life care has got a place, but it's by no means the whole house. So thinking and planning ahead, my hope is that you become prepared so that when anything comes knocking on your door, you've got the tools to meet whatever comes knocking. To go back to Hsien, you mentioned the book that you've got out, and I can use your beautiful metaphor there. Advanced care planning is about hoping for the best, hoping for the sun, but taking the brolly out and preparing for the rest when it rains. So let's look through each of these windows in a little bit more detail. So the things you do want could be a statement of wishes and preferences. And again, I'm aware we've got colleagues from England. I'm talking to colleagues, friends and family. I know it from England too. Special shout out to family I can see online there. So for every single one of these statements that I'm going to give you, I'll urge you to talk to your healthcare providers because the actual forms will vary where you're living and in which country you're living in. So a statement of wishes is something that you build your house upon. Think about the things, the values that give you joy, that are important to you, and build healthcare decisions on that. That's a great starting point. Things you do want, maybe organ donation. And in the UK, we've just opted to the opt-out system as well. So think about what you want for your organ donation wishes. Some people may wish to donate their body to medical research. That's not something you can do at the last minute. You need to think and plan ahead for that. It doesn't just happen. Joy lists. Andrew Saunderson, I believe a fellow Canadian, talks about joy lists, creating advanced care planning on the things that bring you joy. Walking that dog on the beach. If I have treatment Y, can I walk my dog on the beach? Or will treatment X enable me to do that? So our next window we'll look through very quickly are the things that you don't want to happen. That could be an advanced decision to refuse treatment, potentially something like CPR. In the UK, we had people tattooing CPR wishes on their chests. I have to urge people to saying tattooing it on your chest isn't effective. If you know there's a treatment you do not wish to have in the UK, for sure, you do what's called an advanced decision to refuse treatment. And I'll urge you, whichever country you're in, to find out the right tool for your country. Who would speak for you? In Canada, you call that a proxy decision maker. In UK, we call that lasting power of attorney. And we have lasting power of attorney for health and welfare and also for property and finance. There is no automatic right for your next of kin to talk for you or manage your bank account without a lasting power of attorney. Your legacy, we've touched upon this already. So your legacy is another really important window of advanced care planning. What does your legacy look like? It's about how you want to be remembered. It's about making memories. Some hospices do things like handcasts. It's about recording your wishes. It could be about writing letters to leave, potentially in a will. Something we often forget about is our digital legacy. If we had more time, I'd ask for a show of hands. Who has got a Facebook account? Who has got a Twitter account or a single photo stored online? That all creates your digital legacy. And what would happen to that? I was going to say if you died, my goodness me, it's when we die. It's 100% mortality life, isn't it? We're all going to die sometime. And I still say the word if. I don't know why. Legacy, people often think about funeral. There are so many different options with funerals. I spoke yesterday about looking at the flash mob that was created for one woman's funeral. Think about what you want. There aren't just two options, burial or cremation. There is so much more you can choose and think about. Will, obviously, whichever country you're in, think about wills. Think about what you might wish to contribute to charity. So that's a very brief look at 4 windows. The final window I'll peep through is end of life care. And I'd just like to urge you, Hsien, you talked about upstreaming care. All of the stuff I've spoken about so far is not to do with end of life care. These are things that matter to us all. We need to upstream our planning. There are certain skills we need to think about in end of life care. We need to think about what we need for the last years of life, specifically treatment escalation plans. The last months of life, the care planning becomes subtly different. We may like to think more specifically about the benefits that may be available to us in whichever country. And by the time you get to the last days of life, this is not the time to start advanced care planning. This is the time to bring those beautiful plans into fruition. I could fill 100 slides in 100 minutes with the tools that are available to you. I will just offer you 3 in this presentation. What matters most conversations. I've spoken about the foundations and we'll give you the link to these websites. I have to do a shout out for the UK Planning Ahead tool, which is through Dying Matters website. And there's a fabulous book called My Future Care, which collates all of this information. You can also find out info on my website. I urge you to subscribe to the podcasts, and I have a blog section with a brilliant new search icon. So I look forward to people sharing that resource. So to summarise, advanced care planning is a process, not a form, built on what matters to us all, and it's a normal part of life. And I urge you, what one thing will you do for your advanced care planning after listening to us today? So thank you, Hsien.
Okay, so I know we had promised 30 minutes and some practical tips and strategies. I think we've given almost 30 practical tips and strategies. So we did want to, given this is, I know this is on Zoom, but it is a live event, offer an opportunity for people who took the time out of their day to ask questions. We did get some online. I'm going to invite Kayla back to help us, but I welcome people to send questions in the chat, or if you feel brave, you can take yourself off camera and we can try taking live questions too, whatever you think. There must be a reason why you joined today, and so we want to make it as relevant to you as possible.
Definitely.
Kayla, are you Oh, hi.
We have a quiet group this morning, but I'll just give everybody a chance. So I'll start with a question. Maybe this is in the back of everyone's mind. This is for both of you. What's the single most important thing you think we should all do when planning for later end of life?
Do you want me to kick off with that?
Yeah,
Hsien?
let's start with Claire and then Hsien.
Yeah, so I would say start early. So start planning early. I'm going to be cheeky here and have 2, Kayla. So start early and find out what matters most are the things that I would suggest are the most important.
And the single most important thing about planning, I think, is to, it really is, the real question is, why don't people want to plan? And I think the answer is because they are scared of dying. And that is, or the idea of what that's going to look like and all the misconceptions about dying, or some of, the images we get. So I think that's why it's hope for the best, plan for the rest. Like, I think the idea of walking 2 roads as early as we can, and this is really, life is all about walking 2 roads. We are hoping for this. And if that doesn't work, what's our plan B? And so it isn't such a foreign concept, but for something when we face with our mortality, maybe understandably so, it's a little different. So I really think if we can normalize this idea of walking 2 roads or changing lanes and moving back and forth, even healthcare providers being comfortable with being in the gray, we will have different conversations and we can hope for the best and plan for the rest. And we say that because we want patients and families to say to their clinicians, I want to, we're not giving up hope. I want to hope for the best, but I also want to plan for the rest. So what do I need to know so I can plan properly? If that's the kind of, information you want. Anyways, I see there are some questions in the Q&A part and in the chat. So I'm going to let Kayla help us navigate this.
Mhm. So the first question is from Rachel. And she says, thanks for this. I work with young people with cancer. Love going back upstream, but not easy. Any tools for young people?
Do you want me to kick off with that?
Yeah, sure. Go ahead, Claire. Yeah.
Ironically, young people often are very much more realistic about planning ahead. They're often very much more open than you expect, and you'd often find it's parents that are more anxious than the younger person about doing that planning ahead. Lots of the tools that we've suggested are equally applicable to young people. So finding out what matters most to them, involving them in decision making. I interviewed an incredible lady called Annabelle Howe, and she, on one of the podcasts, goes into great detail about advanced care planning with children of all ages, starting from quite young children. The one thing that will be very different with children is the type of illness that they will be experiencing. So often you'll be having children with very long-term chronic illnesses, something like HIV and AIDS children used to die from, it's now become a chronic illness. So the length of time you care for a child will be very, very different to the length of time you care for an adult. And it'll be that they often know their healthcare providers for a lot longer, which does give you time to plan and work with that child and the family.
Yeah. So it's a great question, Rachel, about young adults or kids. So the things that comes to mind is in North America, they have people called child life specialists. So there's a huge organization for child life specialists, of which I have a feeling that if you find out the organization, there might be some tools. But I also know the Canadian Virtual Hospice, which is it is what it sounds like, an online website that has tons of information. And they recently worked with the Canadian Hospital for Sick Kids, and I think a lot of the pediatric palliative care doctors in Canada, but they created resources specifically for parents and kids, but really the parents who are the ones who are not the gatekeepers, but are the guardians. So they created a whole program and information, and it is about connecting them with other parents who have walked the same journey. I think that's really key, to talk to people who have gone through the same journey to what they're thinking about. So I encourage you, Canadian Virtual Hospice has I can't remember the exact name of the program, but I saw it presented and it's available now. And those resources would be specific to parents and kids facing a serious illness.
Okay. So this is a question from Sarah. If you have a short amount of time with a patient or service user, what is the most important information to include, tell them about to start the conversation? Maybe we'll start with Hsien and then Claire, you answer second.
So I am not a clinician. I am a PhD researcher, but I have done podcasts and I spend a lot of time with clinicians. And this is what I've watched them do. They say, are you the kind of, they do an assessment of the person and they're like, are you the kind of person who likes to look forward and plan, or are you day to day? Just to get a sense of how much information they like. That's the know your style. What's your style like? Do you like things sugar coated or do you like things direct? And then the second question is, if I had information about what the storyline is going to be and looking into the future of what you could plan for and expect, do you want that information, or does someone in your team want that information? And what I have heard is more than 99% of the time, they say, yes, of course I want that information. You have information that's going to be helpful for me for my life and you don't want to tell me? I thought you were going to tell me. So that is the invitation. You're inviting them to the conversation. You don't just blab about the information, but you invite them to say, I have this information. And if you don't want to talk about it now, maybe next time we can talk about, do you want to know what things you're going to expect along the way so you can plan for them? And they will often say yes. So that is the way. I think it's the invitation to zoom out, because that is the context of which the rest of the conversations can happen. What stage am I at? And what decisions do I need to make at each of the stages? Because every stage has different decisions that are all extremely important to the quality of your life. Claire?
Yeah, so I would echo everything you've said, Hsien, and also compare it to something like a birth process. So it's about explaining and talking through with people that we do have that blueprint. We do know the stories that illnesses go through. We can call it the chapters of an illness. So rather like a birth, whilst every woman will experience, or well, every person will experience a beautifully unique birthing experience, from a healthcare provider point of view, we know that every woman will go through a first stage of birth, a second stage of labour, and that third stage as well. So it's about customising or adapting orders, helping people to say that we know the stages of illness and inviting them to develop it according to their own menu or to their own needs. So it's the uniqueness of everybody, whilst recognising that we do have an awareness of those stories and inviting to share those stories with people. It's gone quiet my end now.
Oh, I don't know, Kayla, we might have lost you, but I did see a question from Lita. And she asked, how do we talk about this without upsetting patients?
Yeah.
Maybe Claire, I'll let you jump in first.
Yeah, I think I work really hard. That's a great question, Lida. A lot of people talk about difficult conversations, and we get trained as healthcare providers. And how rotten is this? We get trained for difficult conversations. I think firstly, turn that around. These aren't difficult conversations. These are important conversations. The second thing I would say is that I would never go in with a pen and a form. So advanced care planning isn't about saying, right, we're going to sit down and do advanced care planning with somebody, because that would be scary. And I would say that would be quite difficult as well. So if we think about, sometimes I feel it's embarrassingly simple to give an answer to your question. And if we turn it around by saying, what matters most to you? What does a good day look like for you? If you can find out what a patient's good day looks like, how easy then is it to build the care from that? So I would come away from thinking it's a difficult conversation and promote the idea of an important conversation. In many ways, almost forget the frameworks that Hsien and Seow have offered you and just draw it back to what matters most to a person, and then have the bravery to build from there. Zoom out, walk those two roads. I would also offer that it is not giving up hope. And there's a very strong idea among healthcare professionals that you either are curing somebody or you failed to cure, and there is no in-between road. So I think it's being aware that it isn't simply binary cure or not cure. There is a lot of living to do between those two lines.
Yeah, you know what? This waiting room revolution has been like an 8-year journey for us, and before it became a podcast and a book. And what we have learned is it's the framing of things is so important. And so when we frame it in our minds or in our patients' minds as a difficult conversation, it's something to be avoided. But if we've described these metaphors as invitations to get more information, and so this idea of I think the idea of time, how much time people have, has a different feel. Not everybody wants to know that. Some people don't want to think, but information that can help you live your best life is something that they want. So this idea of the storyline from the timeline is different. And so just the invitation to, I want exactly what Claire said. I want to help you hope for the best, but plan for the rest, or to customize your order and give you the best care possible. These are different invitations. So would you like to talk about how can I make you most comfortable so you can have the best quality of life, or live fully as much as you can? These are things patients want. So framing it as an invitation of what they want, and how we can help you achieve that. Many patients that I've seen who have gone through this find information like this helpful. Are you the kind of person who would like that? Or is someone in your inner crew going to want that information to help you and support you? I'm open to having that conversation if you are, and that kind of thing. So I think that's all framed in a hopeful way, and hope evolves. As we know, you can be more hopeful when you have realistic information. That is what we have found. And so I think that is another way to frame it. People who have more information actually feel like they can make more choices and more control for themselves. And so I invite you, if you're interested, I can chat about that. I can make time to answer those questions, or I can share with you the Zoom out. So those are some of the ways that people have done it that I've seen. I see Kayla is back. We lost her for a second, and I don't know, maybe we have time for one more question before, or did we just lose her? Before we head out.
Well, I know there was one submitted question, so I wanted to ask Claire this. When choosing who will speak for me or power of attorney, can you list your own hierarchy based on the individual's availability?
That is a great and very topical question. Thank you, Kayla. So when you make a power of attorney, and again, a warning shot, this applies to UK, I urge you to check your laws in wherever you're listening to. If you have your power of attorney, if your attorneys, the people that will speak for you, can act jointly and severally, you actually cannot have a hierarchy of order. So it's a really important shout out there. If you have attorneys that act jointly and severally, they can't, you can't list a hierarchy. It's a really contentious point at the moment, and it's actually going through the Royal Courts of Justice, because some people are trying to create lasting power of attorneys with that hierarchy, which is actually contradicting the instruments or the forms that you use to create them. If you wish to have a single attorney and then substitutes step in from that, or replacements as we call them, you can have a 1-2-step hierarchy, but you can't nominate those within the form. You can only do it by having a primary and then multiple substitutes, but the people that speak for you jointly and severally, you can't have a hierarchy within that. So a little bit complex. I hope that makes sense, and I'll be blogging about that very shortly as well.
Yeah, and I think in Canada there is, if you just Google power of attorney or a hierarchy, they're called substitute decision makers, SDM. There's a very clear pyramid, and where it is automatically assigned. And if it's only when you want to change that assignment, like for example, children is a category. If you have multiple children, they have equal power and they have to make the decision all together. So if you only want one of your children and spouses above that, if you only want one of those children or 2 of them, then you need to say that. Otherwise, all 5 will have equal power. So there's an automatic hierarchy, but if you want to change that or make it slightly different, then you would need to write that. And yeah, knowing that hierarchy is important in part because, again, if you want to make changes or it's sort of how it's going to plan out. I think we are very grateful. I can speak on behalf of Clare to thank you for this 30 minutes that you had to introduce our work to you and to participate in UK's Dying Matters Week. And we can stick around with any more questions, but otherwise, thank you so much for joining us, and we hope to connect with you online or through our different blogs and podcasts, and have a great rest of your day.
Brilliant.
Claire, did you want to say anything before to end?
No,
I didn't want to end up.
Thank you for showing up. Thank you for helping things like this normalise advanced care planning. So what one thing will you all do after listening today is my last shout out and key message. But thank you. Any questions, contact me, direct message me, or through my website, or subscribe to the podcasts. Thank you.
Thank you, everyone. It was a pleasure.